The patient came from Bangladesh. She's a 28-year-old lady who came suffering for pain for almost 7 years from the back of the neck going up the head. So when she came, she had treatments in various hospitals in Bangladesh, in India, in various cities in India, including Chennai, but no relief from the pain. So when she came and met me first at MGM Hospital, we clinically diagnosed her to have a condition called occipital neuralgia, where the pain comes from the back of the neck to the back of the head. But first we had to diagnose that this was actually the problem. So we did a high definition 3 Tesla MRI, which we have here at MGM, and after consulting with the neuroradiologist, we then decided that this was probably the cause of her problem, which was not addressed properly and not effectively enough previously. We then decided to have a discussion, and we had a multidisciplinary team discussion with the intervention radiologist, Dr. Naveen, Dr. Arun, to decide on what will be the best way, but minimally invasive, without an operation, to cure her of her pain. Regularly, we have been doing, as neurosurgeons, operations for these conditions, but with technology currently present, I wanted to know from them whether we can use this technology to help her without a major operation. So after many discussions, we then decided that we will try this new technology which is present, which is RF ablation with a cool tip which can control the temperature at that place, because it's a very critical place. It's not a simple place to even do surgery. It's a very critical place because there are a lot of complicated structures around there. So we discussed this. Dr. Ponnaya, our neuroanesthetist in charge, was also consulted because he had to give anesthesia in the CT room. So what was decided, we will do it in the CT room with the help of the CT scan to guide us to go there and do the RF ablation of the C2 ganglion. Now this is pure teamwork, because even as they were doing the procedure, we were all sitting there. Myself, my neuroanesthetist, my neuroradiologist, to make sure and to guide them, help them identify different structures, to make sure that they were in the right place. So that the most important thing with this is that you have to be at the right place. If you are at the right place, you will be absolutely correct. So this is what was done, and immediately after, the patient had complete relief, and she is very happy and going back tomorrow to her own home in Bangladesh.
To a
Operation theatre.
So, and then we used a very small pinhole kind of a thing. So sutures kadayadu edume kadayadu, or small pinhole we used.
Somebody wanted
CT imaging தமிழ்ல சொல்லுவான். ஒரு நுண்துளை சிகிச்சை மூலமா வந்துட்டு ஒரு பின்ஹோல் மாதிரியான ஒரு சின்ன ஒரு மார்க்கை வச்சு நம்ம சிடி ஸ்கேனோட கைடன்ஸை யூஸ் பண்ணி உள்ள போயிட்டு நம்ம ஆர்எஃப் எனர்ஜியை கொடுத்து என்ன பிரச்சனைக்கு காரணமான அந்த ஒரு நரம்பு முடிச்சு அந்த நர்வ் ஜங்ஷனை வந்துட்டு நம்ம கண்ட்ரோல்டு அப்ளேஷன் சொல்லக்கூடிய ஒரு சரியான அளவில் ஒரு வெப்பத்தை கொடுத்து அந்த இடத்துல பெயின் எடுத்துட்டு போற அந்த சமிக்ஞைகள் எடுத்து போறக்கூடிய அந்த நரம்பை வந்துட்டு நம்ம அழிச்சு பேஷண்ட்டுக்கு பெயின் ரிலீஃப் கொடுத்துருக்கோம். இது ஃபர்ஸ்ட் டைம் இன் இந்தியா.